Designing inclusive AI, ensuring diversity in health tech solutions.
My name's Julie Adrian, and I'm the managing partner at Fin Partners. We're an integrated communications firm, really at the forefront of leveraging AI in communications. And I'm the esteemed moderator, but honored and humbled to be with this group on the stage today. What we're going to do is we're going to have them introduce themselves, but also answer our first question, which is, why is it so important, thank you, darling, why is it so important that we care about diversity and equity in AI? There's a lot of talk about AI in the world, a lot of talk about it at this conference. Why is this particular component so important? So we will start with you. Introduce, quick introduction, and then give your perspective on that first topic.
Hello, you hear me? Yeah, okay. So my name is Valletta Reinhardt. I'm the CRO and co-founder of D-House, the frontier blockchain infrastructures for health data privacy. Also the CEO of vSpace Global, the AI-based platform for talents in innovation. I think to answer your question of why we need inclusive AI, I would answer with why not? I mean, that's the thing we have to reduce the bias, to enhance the fairness, to compliance, to the regulatory, and as blockchain technologists, to improve trust in healthcare, we need trust.
Excellent, excellent. Liam.
Hello everyone, my name's Liam. I work at the University of Malta as a researcher. My work focuses mainly on using VR as a form of distraction therapy, and then using what we call effective computing to change the game for the emotion of the user. So mainly we make the game more fitted to the user, to the patient. And to answer your question, I think inclusivity is important in the sense that what we are targeting mainly is patients. And if it's not personalized, the AI system to the patient, it's of no use. That's mainly it.
Philippe.
So my name is Philippe Gerville. I'm mainly an international speaker, but also advisor in probably more than 20 companies. I'm also mentor, coach for the younger generation. I have amazing talent in my network, 15, 16 years old, and I really love that, to give back to the community. Regarding the question, unfortunately, we should not talk about it, but it's a pity that we have to talk about it. It should be normal that we talk about diversity,
Agreed.
being women, being LGBT or whatever.
Gender.
So it's just a pity that today it becomes a topic. It should not be a topic.
Yep. Completely understood. Hopefully this will not be a topic on any panel moving forward, right? Go ahead.
Yeah, thank you very much. My name is Georgi Chaltukyan, and I'm very pleased to be here on this panel. Thanks to the organizers, obviously, for inviting me. I am a professor and head of Digital Health Masters at Tegendorf Institute of Technology in Germany, and also at the university in Yerevan in Armenia. So I belong to both Germany and Armenia. I was born and raised in Armenia. I'm a medical doctor by my background, so no tech person per se, but more on the healthcare, medical management, development, policy side of digital health, and of course AI. There is obviously no health without digital, and there is no digital health without AI. This is quite obvious. And of course, the most important contribution of AI is going to be in what I like to call 10P health, and it's the same concept first introduced by Dr. Leroy Hood, the P4 medicine: preventive, predictive, personalized, and participatory. And that is obviously where AI is yet to provide its major input. We're not yet there. I always tell my students that digital health is still a baby, a newborn baby, I would say. And I very much, I would love to repeat the words of, I think, Ilya Sutskever once said that when we look into the real healthcare, or I don't even call it healthcare, I like to call it health and wellness of the 21st century that is coming up in probably 1 or 2 decades. When we compare what we have, that vision of health, to what we have today, it is the same as we compare what we have today to, let's say, 16th century dentistry. And speaking about inclusivity, to me, it all translates into, obviously, into patients' outcomes. So the more inclusive is data, the less biased is data that AI models are trained on, the more fair models and algorithms, eventually the better are going to be patients' outcomes.
Right, and the more relevant.
As simple as that.
The more relevant, the more bespoke, the more it's going to deliver. So I'm going to take it back to the middle here. I kind of feel very excited about this panel that if all of us were one person together, we would be like the perfect superhuman to tackle this situation. We've got health, we've got like the coding. So I'm going to take it to you two in the middle, Philippe and Liam. What is the most important strategy that you think we could adopt or launch to ensure that there's equity in AI?
So the most important thing, in my opinion, is when designing AI solutions for patients, it's important to talk with different, let's say, organizations. So if I'm basing my research only in Malta, it's not good because, okay, we're a bit diverse in Malta, but we need more diversity. So if I say my solution works, but I only tested it in Malta, my data is only for the Maltese population, and we are not taking into consideration ethnic diversity. And I believe that we need to talk with other partners, with other countries, when doing these solutions, so we know that if in fact it works.
So open your aperture. Don't just look at what's right in front of you. Philippe.
Again, to jump on that, I think the key point is it should be by design, but also there's a lot happening now still by countries. You know that I spend a lot of time in the Middle East, so genomics discussion in the Middle East for the Arabic population is something different than here. So how you bring that together, so I think it's of course by design, but you still need this local data. And again, for AI, we need a lot of data, and that's also why we talk about bias hallucination, because the data that you have today is not where it should be. And I think also the point is about a lot of people say, yeah, AI can do everything, just put the data inside. I still believe that you need to understand the data at the moment you what you want to do with the data. Because it's difficult to catch up if you didn't have the data yet and you try to get 20 years back and try to, one parameters, whatever, is going to be difficult. So all by design, you have to keep that in mind, and again, the whole then inclusivity as well.
Starting with the end in mind. So absolutely, where do you go with that?
I'd say yes, indeed. Important is, of course, the design. But it is, as Philippe said, very important to consider the local context. So what we have today, we have wonderful models, large models, that have been trained on massive amounts of data, indiscriminately, right? It's just the data, whoever, gets access to that data is able to train a model on that. And I think we're already witnessing, and we will be witnessing it more and more, there will be more customized, tailored apps. They will be, the large models will serve the foundation models, indeed as foundation for multiple locally adjusted apps, specialty adjusted, and local settings adjusted. And I believe that should be one of the important revenues, customer fine-tuning those models, always to the local context that can be different, not only with regard to population, ethnic background, ethnic landscape, so to say, genomic landscape, and so on.
Socioeconomic,
also the healthcare settings, the structure and functioning of health system, and so on and so forth.
Yep, absolutely. What do you think? What's the number one strategy we need to employ?
You all have the keyword of data designing, but I think the strategy should start with the human. As a manager, so you have to put ethical thought into every designing. You have to hire the diverse team, and also in the mindset, in the strategy you have for the team, and then the tech part, it just come later. You have 5, 4, 6, 7 step of data collection, data annotation, modeling, and so on. But if you, at the leaders, have the right mindset and the right technique and the right ethic, then you can put everything in one place.
Yep. So I'm going to move to like barriers. I'm going to send it to you first. So you mentioned mindset, the right mindset. Certainly that's a big barrier, right? If we're not thinking of this in the right way, starting from the beginning, if we're not opening our aperture, what are the other barriers that we need to keep in mind? Start with you.
I still want to jump
That's fine.
on first what we said, because hiring a diversity team sounds great, but it's not easy if you really want from that point of view. And I would still challenge, if we need this diversity in the team, I want everybody to understand diversity. See, that's my point, because I have to understand, women, I have to understand men, I have to understand LGBT and all that. If I want to hire a woman to understand woman health, a man to understand man health, True. So I'm saying that's... True. We are not going, we entertain these silos. So I really think it's about everybody understanding this diversity.
Interesting. I love that. Being inclusive in our inclusivity. Okay, so let's talk about any other barriers. I think that's a great one. Like, that's a really interesting perspective. Where do you go with barriers? What, like, from an on-the-ground coding development, what's the biggest barrier?
One of the main barriers right now is technology. So if I want to build an AI model, if I don't have the capital, let's say, it's a bit difficult. So there are models available for free. However, you do not know what data they used. So if the data, we have a saying at our team at the university, it's garbage in, garbage out. So if we do not, sometimes we don't know what type of data they used. So we have to rely sometimes on trying to make an AI model which is simple. But then when we make a simple AI model, it's not inclusive to everyone. So there are resources right now, and such as NVIDIA and other companies are giving servers to train your AI models for a fraction of the cost and like 10 years ago. So yes, there are openings right now, and I think that's the barrier right now, but it's being addressed, I think. Okay.
Any other barriers, from you?
I think as a person working in blockchain, we understand really well the data accessibility and the data availabilities. We all working in healthcare, and we know how silos it is and how difficult it is to compliance to every industry. Also, we have to get the right balance between the accuracy and fairness. Because everyone likes to have inclusive AI, but in reality, it's really difficult. And when it comes to audit, so the point is we have to do it right, and we have to do it right now. But how about the data set that you just did like long time ago, and now you have to have accumulated so much more data, and then how do you trace back then when it's not inclusive enough?
Yeah. Over to you, Georgie. What do you think? Biggest barrier?
Yeah, thank you. Well, if tech people speak of the technology as a barrier, obviously. So I will be speaking about the barriers coming more from the healthcare folks, because I mean the barriers are plenty. We usually spend, not just hours but weeks in our teaching, just looking at and discussing the barriers and the risks, obviously the challenges, because that is much more important, than looking at the advantages that appear obvious. Well, the data quality, as Liam mentioned, is of paramount importance, obviously. Here's just one figure. We know that there's already about 1/3 of all data in the world is health and medical data. 1/3. I dare to predict that in, let's say, 10 to 20 years, that 1/3 will become at least 2/3, if not 3/4. But we also know that 97% of that 1/3 is not actually usable data. It cannot be used to build more
Garbage in,
data.
garbage out.
Exactly, GIGO, exactly that principle. But what I also wanted to call our attention to is the fragmentation. I think we need much more dialogue. We need, there was, for example, a paper, a wonderful paper published in New England Journal of Medicine AI just a few months ago about a need to establish what they call artificial intelligence implementation science centers. A network of centers that are specifically concerned, with developing, comparing the policies of building inclusive, fair, quality AI models. I think the more dialogue we have, the more we, the entire community understands and is capable of monitoring how it all is developing, how it all is done, the better.
Love it. I love it. So maybe what it is taking the garbage in, garbage out, recycling it into something usable. And I know you like that, Philippe. You tell. What about you, barrier? And then we'll go to our last topic.
I think there was some discussion already before. I see a huge challenge on the regulatory side. And again, for me today, unfortunately, regulatory is a barrier, and there's a huge need of change in regulatory, because the speed, the things are happening. We cannot take anymore 4 or 5 years to talk and then making 10 years to implement and it's valid. So we need new skills in the regulatory population, and to understand adaptability as we move. But these need new skills, this whole policies and regulatory environment, even government, they are not used to that. It's a new world for them. So what they do actually, they are afraid. So they stop. Even if you
Just don't do anything.
Yeah, and if you are, you remember, when OpenAI came out, Italy stopped ChatGPT in Italy. France was very close to do it too, because something is the unknown coming. So I think as we have to change the way we work, everybody is going to be impacted, including regulatory.
And then ethical considerations, I think also put at the top of the list. Last topic I just wanted to bring up is this idea of health disparities and how that can be addressed in this way with AI and equity, and how can we best approach that in the future? You've touched on it a little bit, but how can we tackle that, and what's the best approach there?
I always start with human leadership. So start with the leaders with the right mindset, the right ethical attitude, and then you decide it. So you have the right team to design the right methods, the right technologies, because we talk too much about data, but everything based on data. And if you collect it's not the right way, not inclusive way, and then you annotate it, you do the wrong modeling, then everything is gone wrong.
And perhaps if we're successful in that kind of human-focused data collection, recycling the garbage, we can actually solve some of the health disparities. That's the promise of this technology, right? I mean, this is where it should go. This is where it should go.
And I may add up, you always have to do auditing. Because regulatory and everything, we have the whole good protocol, but if no one, we do not audit it correctly, everything can go wrong.
Review. You want to key off of that?
So for me, I think, as we were saying, sometimes we lose focus on what we are doing, actually. So we lose the human touch. So we just want to build AI, but actually we're trying to help patients, first of all. So that's the most important thing. And the second thing about AI in healthcare, sometimes what I see is teams add AI to everything. But the question first must be, do we actually need AI in that specific set? Because I think sometimes AI becomes this buzzword that we want to implement it just to say we've implemented AI. However, I think even some professors told me the first thing you need to do when implementing AI is say, do we need AI in this? So I think if we want to move forward, that's a question we also have to have in mind.
Yep. And to what aim? Go for it.
My answer to that question is yes, I need AI. I'm not asking the question because let's put the elephant on the table, and we already had a discussion, Julie, about that. Recently I got interviewed in Brazil by O Globo, and I'm very happy about the title they put. The title that what I took out of my interview is "Doctors are becoming robots, and AI can free them up." So it's the opposite of what a lot of people think, but that's the point today. You go to a GP, he has 10 minutes. Out of the 10 minutes, 70% is looking at the screen, entering data. So only if I can remove a piece of this 70%, maybe he will become human again and look at the eyes of the patient. So that's what I'm saying. Today, yes, I need AI. I need AI to release our human capabilities. AI is just a tool that should help us to become more human, and not the other way around.
To your point, if we can arm the healthcare professionals with AI tools to help them be more equitable in their care and in their delivery, meet the human element, we can get rid of a lot of those health disparities.
That's actually the title of Dr. Topo's book, right?
Yeah.
Deep Medicine, How Artificial Intelligence Will Make Medicine Human Again. Exactly what Philip is talking about. Yes, absolutely. I stated it in the very beginning. To me, no health without digital, no digital without AI. So there is absolutely no question. The one question that is troubling me, though, is indeed how and how fast we achieve this inclusivity, because it is quite a challenge. Yes. And I wouldn't say that everything is absolutely brilliant there. And yes, in 10 years from now, all the 8.5 or 9 billions of humankind, of humans all over the world will have access to high quality. Let's face it, we know it's not going to be like that. Yeah. We know the diversity will remain for some time, and we know we're going to need massive effort not to just bridge the divide. I would say not to exacerbate the divide. Yep. Because let's face it, there is a lot of money that is needed to build this AI-based 10P vision of the future of health. Furthermore, it is already available today, but it is not affordable to 99% of humankind. Yep. These are the questions. Yep. I very much would agree with that we need leadership there, strong leadership, commitment, and we need education. Yep. In order to bridge the divide, we also need education. And that is where I see my mission primarily, because keeping in mind that I am first and foremost an educator.
Yes. Prof, thank you for that was your drop the mic last comment. What's your drop the mic last comment that you want these folks to take away?
Ethic. Everything you do, leaders, team members, everything you do, everything you design in life, think about this ethical attitude.
Love it. Love it. Liam.
I think my final remark would be that for future coders, especially when we do AI in healthcare, the main focus should be on personalization nowadays. So if we build an AI model, we need to see how we can personalize it to all the users we have. That's all.
Love it.
And to add something different, I would also put trust into the game. Because in healthcare, there's a lot about the trust between the doctors and the patient. Now we need to build trust between AI, the doctors, and the patient.
I love it. And I think for those of you, if you were here for the whole talk, we had some amazing quips. I always love to give the quips. We're a newborn baby. We have, AI is a newborn baby, maybe even a premature baby at this point. We need to focus on that. We have that we must be very human. open our apertures, really connect. There's a bias hallucination. I don't want to get that, whatever that is. I don't want to have that disorder. But we have to focus on not working through that. And then also, we're going to quote you probably the whole thing, garbage in, garbage out, but we're going to recycle that garbage and absolutely help physicians and patients leverage AI in all the ways that we can to improve equity and health. Thank you all. Thank you, panel. Amazing support. Thank you so much. Have a
Thank you
good
very
day.
much.